All right, it looks like our numbers have kind of slowed down of people coming in. First off, everybody, thank you very much for joining us. We felt that it would be a worthwhile venture to get all of our trainers together so that we could go over some important veterinary related information pertaining to Breeders' Cup 2021 being held at Del Mar. With me is Dr. Jeff Blea, equine medical director for the California Horse Racing Board, and he's going to be bringing forth some of the California specific veterinary medication regulation. Just so you know, we're also going to be doing this for the veterinary practitioners. Our goal is to be as transparent as possible with everyone to make sure that no one, this is not a gotcha type thing. We want to make sure all the information is out there. And at the end of this, there's a list of contacts. So feel free to reach out to either myself, Will Farmer, or Dr. Blea. Our email, phone numbers are there. We can help direct you, either get you the right person or answer any questions that you may have. As we go through this presentation, there should be a button down at the bottom where you can raise your hand. Feel free to do that. Currently, everybody is muted just for feedback purposes and trying to control the overall background noise. If you want to ask a question, we are going to do a Q&A session at the end of the presentation. But if we're going through something and you have a pertinent question to where we are at that point in time, feel free to click on the raise your hand button. I've got that on my screen. I'll then be able to unmute you, allow you to ask your question. An alternative way for those who would prefer, there's also a chat feature. Feel free to type your question in on the chat feature. That shows up on my screen as well. And we'll make sure that we try to address any questions that we do get as we go along. Like I said, we'll do a Q&A at the end as well. So with that, not to delay any longer, I'll turn it over to Dr. Blea, and he can start with the CHRB information.
Good morning or good afternoon or good evening, wherever you might be, and thanks for taking the time to join us this morning. As Dr. Farmer said, when we all got together earlier this summer, we realized there are a lot of new rules and changes in California in the last 2 years, and since the last time Breeders' Cup has been in California. So we got together and put together some information, but we felt it was prudent and important to get some of this information out to the horsemen ahead of time, more so in a matter of providing this education so you understand what the changes are, how to make it easier when you're out here, and provide a lot more clarity when you're here, especially with certain rules such as joint injections. So out here in California, we have quite a few monitoring vets nowadays. We have at least 2 on the racetrack during training, and we have several that go out and do barn exams throughout the morning. Because of that, we tend to know our horses quite well in our population. People are coming from all over the world for Breeders' Cup in November. You know your horses. Your horse has some thick ankles. Your horse has quite a bit of a fusion in a knee. You know that. Your attending vet knows that. We don't know that. There's going to be a lot of examinations done, veterinary examinations during Breeders' Cup week. We recommend that if there's something you're concerned about at home, do the diagnostics at home. Bring your report with you. To us out here in our veterinary community, the known is much better than the unknown. So if we know there's an issue, we know you've addressed it, we know you've looked into it, and we're comfortable with that. That's a simple way of avoiding a lot of problems during Breeders' Cup week. Along with that, all these horses move differently. We all know that. Some horses have a stiff gait, some are choppy, they paddle when they jog. You know your horses. If there's something unusual about your horse, contact the attending or the official vet when you arrive. Say, hey, look, come take a look at my horse. We just got here. Be proactive about that. The more we see these horses, the more we're comfortable with them, and we can avoid a lot of surprises later in the week. So we're not here. It's not us versus them. We're all working together. And if we're transparent with one another, we're not out to get anybody. We're out to provide a safe and a successful week of racing for Breeders' Cup. So that's how we approach things from the regulatory standpoint out here in California, and your cooperation is greatly appreciated. This next item won't apply to many of you, but I put it in there just because I thought it was important. If by chance you haven't run for 4 months or 120 days, by law in California, not only by rule, but by state law, you have to have an official examination done by an official veterinarian prior to entry. There's no blood test, but you do have to have an official examination if you have a layoff greater than 120 days. So I don't think it will apply to many, but just be aware of it if you're coming into Breeders' Cup Championship weekend fresh off the layoff. The horseman's agreement, all tracks in California have a horseman agreement that trainers and veterinarians, attending veterinarians, are required to sign. That agreement is in the Horseman's Information Guide from Breeders' Cup. And it basically states the rules required by track management, and some of which we'll cover later on in this presentation. Withdrawal guidelines for medications are listed in the Breeders' Cup. We tried to lay those out very clearly and succinctly with some thresholds as well, but they are all listed in the Horseman's Information Guide. And if you have any questions about those, don't hesitate to contact me and I can help clarify things. Veterinary records for horses shipping in to race in California. If your horse has not been on a CHRB racing or training facility for 30 days prior to racing, we require the trainer to submit veterinary records for the previous 30 days. The veterinary records shall include the name of the horse treated, any medication, drug, substance, or procedure administered or prescribed by your veterinarian during the previous 30 days. We also ask the name of the prescribing or treating veterinarian should we want to talk to them. All records are kept confidential through the CHRB so that we make sure they remain confidential. And we ask that the veterinary records be emailed to the official veterinary office, and the address is listed there at OV SoCal Thoroughbred, tb@yahoo.com. We require this on all horses. The summer meet horses that would ship in for the ship and win bonus, they had to provide veterinary records for the previous 30 days. And so a lot of people are used to it. It's not very onerous, but it is very helpful. And we need to have those when you do come in.
Dr. Blay, I want to add in too, I forgot to mention this at the beginning. This presentation is being recorded as well. So there's information on here, such as the email address. This will be hosted on the Breeders' Cup members site. Probably towards the end of this week. It'll take us a couple of days to get it loaded. So if you need to come back and reference this presentation will be available, so you can come back and get email addresses or phone numbers. So some of you might be frantically trying to write down different things right now. Just know that it will be available at the end of this week. I would say by Friday, it'll be on the Breeders' Cup members site.
Great, thanks, Dr. Farmer. And the goal of, part of the goal of recording this and providing this is to provide a resource for horsemen that they can go back and pull it up on their phone or on their laptop or what have you. So that, we try to be very inclusive with our information for contact. So that's great. Medications and substances permitted after entry. In California, we consider entry time at 48 hours. So at 48 hours prior to post time of the running race of your race, that's your entry time. Wednesday for Friday races, Thursday for Saturday races. Nothing is permitted within 48 hours other than the following 4 items. By injection, your vet may administer injectable vitamins, tetanus toxoid or antitoxin, approved ulcer medications orally, for example, Gastrogard, cimetidine, ranitidine if available, and isotonic fluids are permitted up until 48 hours before the post time of your race. Authorized medication during workouts. We have a 48-hour stand down for nonsteroidals. That's for both racing and working. In addition to that, the first bullet point is you may not administer a local anesthetic or narcotic analgesic to any horse within 24 hours of timed workout. You may think that's a little bit not applicable, but the narcotic analgesic is the important item here. For example, your horse needs to be shod. You're going to shoe him on Tuesday and work him on Wednesday, but your horse also needs to be sedated with ditomidine and torbagesic. Well, torbagesic is a narcotic analgesic, and if it's found in a post-work blood sample, it is a violation. So just be aware of that. You need to get your horse shod. Try and do it at least 48 hours before work. In addition, not more, as I said, not more than one non-steroidal anti-inflammatory may be in a horse post-work if a sample is taken. So again, 48-hour withdrawal time for non-steroidals if you're going to be working in California. A couple other notes, especially on race day or as we approach race day. Nasogastric tubing. In practice, a lot of my clients would like to tube their horses with electrolytes. In California, it's a 48-hour prohibition. So you're not allowed to tube your horse within 48 hours of post time of the race. Again, water only on race day, that sounds pretty rudimentary. However, we've had people try to administer wind aid and other products. Anything other than water that is used to flush a horse's mouth will result in scratching of that horse from the race. So water only. There'll be a lot of investigators, a lot of security. Just keep it simple, use water. Nebulizers, people often ask, can I nebulize my horse at 24 hours? It's just saline, it's just distilled water. In California, we have a 48-hour withdrawal time. Again, nebulization is considered an administration method, whether it's a medication or whether it's just distilled water. It is still a 48-hour stand down on all nebulization products. If it is a medication that's nebulized, it has to come with a CHRB veterinarian prescription. Mandatory ship-in time. Dr. Farmer, you can talk more about this, but everyone is required to be on the backside of Del Mar by Tuesday, November the 2nd. And part and parcel, the reasoning for that, there will be comprehensive out-of-competition testing that takes place on Tuesday, November the 2nd. It will begin at 11 a.m. And at this time, we're requiring all trainers have a representative at your barn, whether it's yourself, your assistant, your foreman, what have you, between the hours of 11 a.m. and 3 p.m. so they can present that horse for out-of-competition testing. If no one is present, that may result in the horse being scratched from the Breeders' Cup.
Yeah, so this follows, entries will be on November 1st. So at this point, all horses will have been entered. So we know who needs to be on site. As this year, all horses have to be on site on that Tuesday rather than the split as it's been in the past. So this is a big change from what we've done in the past. We are going to be doing out-of-competition testing on all entered horses on that Tuesday. So just a heads up to everybody. We're not trying to play a gotcha. We want to make sure everybody is aware of this. But on that Tuesday, everybody does need to have someone at their barn because we will be testing all Breeders' Cup entered horses that day.
And we're going to have a team of, if I believe, 8 veterinary teams with someone to assist. So our goal is to make it efficient and very convenient for everyone. So you're not hanging around all day and your horse can rest when they need to rest.
Correct. Yeah, we will have 8 teams. There'll be a veterinarian and an assistant who are going to be coming around. So yeah, our goal is to make this as efficient as possible for everybody. So hopefully we are done ahead of time, but to make sure that we get through everything, we do need somebody there from that 11 to 3 p.m. window.
Intraarticular injections, our rules have changed in California in the last 2 years. So for clarity, there's a couple bullet points here. In California, there's a 14-day stand down for all intraarticular injections. Doesn't matter what joint, doesn't matter what product, hyaluronic acid, IRAP, biologicals, corticosteroids, 14-day stand down for all intraarticular injections. Our time points are, if you're going to run on Friday, it's 2 weeks prior on the Friday. That's when your 14 days begins. So 14 days, Friday to Friday, 14 days, Saturday to Saturday. In addition to that, if you inject a fetlock, any fetlock, front or hind, with corticosteroids, that's a mandatory 30-day stand down. All fetlock corticosteroid joint injections require a 30-day stand down, of which that horse is ineligible to run in California. So that's very important. You can medicate fetlocks with HA biologics at 14 days, but if you're going to use corticosteroids and fetlocks, you have to maintain a 30-day stand down. Any finding of a corticosteroid in post-race sample will result in disqualification, purse redistribution. From a practical standpoint, I would recommend, if you're going to inject stifles or hocks with corticosteroids, I'd push it back to 21 days, because we've had some problems in those type of joints where the medication tends to linger longer than the 14 days. So my personal recommendation is, if you're going to inject joints, I'd push it out to 21 days. You'll still have the effect, and you'll have a peace of mind, so to speak. Nonsteroidals, NSAIDs, we touched on that a little bit earlier. 48-hour withdrawal applies to both works and races. Only one of 3 nonsteroidals can be present in a post-race sample, either phenylbutazone, banamine, or ketofen. If you have 2 nonsteroidals in a post-race sample, that is a violation. The simplest way to avoid that is, if you have to give your horse a nonsteroidal in the week up to Breeders' Cup, based on IFHA recommendation, the withdrawal guidelines are posted here on this slide. Bute can be detected in urine for up to 7 days, banamine up to 6 days in urine, and ketofen up to 4 days. So, for example, if you're going to run on bute on Friday, your veterinarian treats your horse Wednesday morning outside of 48 hours, and let's say the horse had banamine, you want to make sure that banamine was at least 6 days prior to Friday's race. Furthermore, if you're going to run on banamine, I would recommend, rather than a 48-hour treatment, I would go out to 54, maybe 56 hours. So do it early in the morning, 2 days before, just to avoid any potential problems. Lasix. No Lasix is permitted within 48 hours of any Breeders' Cup championship race. All races, Friday and Saturday, all races, Friday and Saturday, will be Lasix free. So no Lasix within 48 hours of the race. You can work on Lasix, provided it's not within 48 hours of the race. Clenbuterol. We have a pretty strict Clenbuterol rule here in California. I know some other states do as well. We recommend a 6-week withdrawal time for Clenbuterol, and I recognize we're already within that window. However, so you're aware, there is no permitted threshold for Clenbuterol in California, and our testing is very sensitive. If you've been on Clenbuterol, if you're concerned about it, if your horse is still on Clenbuterol, I would strongly recommend you get pre-entry tested with both blood and urine. You can contact me and I can get that sorted out for you. But if he's been administered Clenbuterol recently, I would advise you to get pre-entry tested, and it requires both blood and urine because, like I said, we have no permitted threshold for Clenbuterol. Penicillin is an authorized medication in California under some specific guidelines. The official blood test cannot exceed 25 nanograms per ml of procaine. The administrations of penicillin have to be reported pursuant to Rule 1842. It cannot be administered after entry into a race, but you can administer it prior to racing. The horse may have additional surveillance required prior to racing for 6 hours. And if your horse has been treated with penicillin or will be treated with penicillin and you're at all concerned, we offer free testing for procaine and in California. We can expedite that, but you'll have to give us a little bit of lead-in time. My recommendation is any horse that was treated with procaine penicillin in the 30 days prior to the Breeders' Cup be pre-race tested or pre-entry tested. Shockwave. In California, we have a pretty strict rule, which is a very recent rule. We have a 30-day stand down for all Shockwave treatments. Any treatment within the 30 days prior to a race day, that horse isn't eligible to enter the backside, not only to enter a race, but to be on the backside. So it's a 30-day stand down. No horse within 30 days of Breeders' Cup shall have been treated with a Shockwave therapy. If so, that is a violation and will be ineligible to participate in Breeders' Cup. And we're at that 30 days now, so just be very aware of that. Bisphosphonates, recent rule 1867.1 prohibits the use of bisphosphonates. Horses that have been treated with bisphosphonates within the last 6 months of race day are ineligible to be on a CHRB facility. So if your horse had been treated with bisphosphonates during the previous 6 months of the race, that horse is ineligible to be on a CHRB facility. It doesn't matter how the horse was treated, whether it was a drip treatment, whether it was regional lymph perfusion, intramuscular, any treatment within 6 months renders that horse ineligible to be on the backside of a CHRB facility. If you test positive for a bisphosphonate, it's a violation and there will be disqualification. The veterinary panel, I'll touch on this just briefly. In California, we have a governor mandated veterinary panel, which reviews all horses that are entered on a race day. The panel consists of the chief official veterinarian, Dr. Tim Grande, myself, and a steward. We review all entries for each race day following close of entries. That will continue for Breeders' Cup. We will extend that or expand that panel, to include 2 Breeders' Cup veterinarians, Dr. Will Farmer, and I'm presuming Dr. Deb Lamparter.
Correct.
Sit on that panel following entries to review factors that we look at as at-risk factors, high-risk factors, and other parameters that we do in the panel review. So we're going to expand that panel for Breeders' Cup to make it more inclusive. And with that, Will, do you want to go ahead and discuss more about the veterinary panel you're leading on?
Sure. Yeah, absolutely. So as probably a lot of you are aware, Breeders' Cup does have a veterinary panel that kind of comes in to assist the host jurisdiction, whether we're in Kentucky or California. We come alongside. So that in total, there'll probably be we'll have around 14 veterinarians that are joining us, that we will have on site, that are participating in the exams of the entered horses. These exams are going to start on October 25th, where we're going to start with both our Trot Up exams, which we introduced last year at Keeneland, as well as barn exams. And we're going to go through those here in just a second. Oops, I clicked too far. 1 second.
Along with those barn exams, Dr. Farmer, they will also involve CHRB veterinarians.
Correct. Yep.
What we're going to do from the CHRB's perspective is each CHRB veterinarian will be assigned certain horses. So that CHRB veterinarian is going to be looking at the same horses day in and day out. And if there's any changes, they'll be keenly aware of them. And so to provide consistency, they'll be looking at those same horses, and horsemen, you'll get used to who they are and you'll recognize them.
Perfect. So just to go over the overall exams that are going to be required. In California, a pre-entry exam is required by the private practitioner within 3 days prior to entry. I know in Kentucky, we have something very similar. That's where your private practitioner will submit a note to the CHRB stating that the horse has been examined, is racing sound. Then we will be doing a minimum of 2 Trot Up exams. These are going to happen in the 7 furlong chute at Del Mar. This will consist of a weight up exam when the horses are coming onto the track. We're going to jog the horses. We're going to do at least 1 stall exam during the week, which is similar to a traditional pre-race exam, only not on race morning. And then we have the pre-race exam that will occur on race morning. And something to note at Del Mar, because of the post times, we do start fairly early. And those stall side race day exams are going to start at 5:30 in the morning on Friday and Saturday. With regards to the Trot Up exam, each horse is going to have 2 of these. When the horse comes onto the track entry gaps, which will be at the 7 furlong chute. It'll be fairly convenient. It's going to be right there. We've got a nice quiet chute. And the horses will just be asked to jog away and back toward us. We'll have a pair of veterinarians there to observe, take a few quick notes. It shouldn't take very long at all. It worked out very well last year at Keeneland. I don't think that it really held anybody up. It was just a quick trot, and then they could proceed on to the main track and continue with their training regimen for that day. For those horses and horsemen that are located at Santa Anita, we're trying to work out an area to do this in the quarter-mile chute. We know that it's a highly congested area, so we're trying to work out the logistics of when this may occur to try and make it as feasible for everybody as possible. Likely is going to occur during a combination worker-only Breeders' Cup session when the traditional worker-only period occurs at Santa Anita. So those details are still yet to be finalized for Santa Anita, but we do know we'll be doing those trot ups in the 7 furlong chute at Del Mar. And there at Del Mar specifically, there will be no specific time for that. Whenever you come to the track, we will have veterinarians there that can trot up those horses. So whether it's first in the morning, if it's the last set out, we will have people there the entire time that the track is open to do those exams. The barn exams, very similar. Most of you are probably familiar with. We'll be examining the horses in the barns, doing a brief physical, and the in-hand trot, be it either inside the shed row or outside at your preference. This will be a team of Breeders' Cup and CHRB veterinarians. One thing to note, as is regulation in California, the CHRB veterinarians can require diagnostics be done. If there's an issue, the veterinarian can request, the CHRB veterinarian can request whether it be x-rays or an ultrasound. Obviously, we have limited diagnostics that can be run week of, but if there's something that we feel needs to be done, we may make that request that whatever appropriate diagnostic be utilized to satisfy any requirements that we may have.
And Dr. Farmer, that goes hand in hand with what we first talked about, is do your diagnostics at home. That way you're not playing catch up here. And those type of situations always cause a lot of consternation and anxiety. If there's something that is obvious or something that you want to be proactive about, get your diagnostics at home, done at home, bring a report. That goes a long way to eliminate problems.
Absolutely. Yeah, and we always deal with foot issues that arise, and so we'll just handle those on a case by case basis too, because inevitably things come up that no one was anticipating, and so we will be adaptable and flow with the river as it goes. So here's some contacts for Dr. Blea, myself, and Dr. Debbie Lamparter. So you guys are able to feel free to reach out to us if you have questions, concerns. I haven't seen any, we're nearing the end here, and I haven't seen anybody raise a hand or anything. If anybody has any questions, please feel free to raise your hand. We're happy to answer any questions while we're live. This next slide, there's a couple slides here with regards to Breeders' Cup condition of entry. And I'm not going to go through all the verbiage. This is on the entry condition, or the entry form. This has been placed in a lot of different places. One thing I do want to just read, excuse me, I'm going to go back to that. Down at the bottom, if any connection of the above described horse has been notified by a regulatory body about pending information, medication violations, that the connections do need to report that to the Breeders' Cup. That is something fairly new for Breeders' Cup. We just want to make sure that there are no surprises if something is going on, that we can deal appropriately and work through. So if between now and Breeders' Cup dates come around, if you are made aware by a regulatory body of an issue, we ask that you please let us know about that as well, so we can work together through that. So here's our prohibited substances rule. Again, published everywhere. There's really nothing that we haven't discussed that's in here. This is more for your information. I'm not going to go through all of the different verbiage, but it's very consistent across the board from Breeders' Cup to CHRB to Kentucky as well.
And Dr. Farmer, along these lines, every state has different penalty classifications. But for example, methocarbamol or Ribaxin is a category C. It's a 4C. A violation in Breeders' Cup will result in disqualification. So just be careful with your medications, err on the side of caution. And, you know, I realize the horses need medications, therapeutic medications, but just be very careful of them. And if you have any questions, don't hesitate to contact myself and or your attending veterinarian, and we'll be happy to provide information to avoid post-race positives.
Yeah, I think the biggest thing here is this is where no one is trying to play gotcha. We want to make sure we get all the information out to everybody so that you can make the best and most educated decision possible for your operation and your horse. And this slide here is really just reiterating what I just talked about regarding any notification of a potential issue to Breeders' Cup. And then I have one more slide here. This is a list of all the different veterinarians and their affiliation. In California, I've got a list of California practitioners. So these are the backside practitioners. Contacts for all of these veterinarians are in the HIG, the Horseman's Information Guide. You can find, if you need to reach out to somebody, if you're looking for a private practitioner, here is a list. The California regulatory veterinarians. We have the Breeders' Cup panel veterinarians, the USDA for anybody involved with imports. There's USDA contact. We also have some quarantine veterinarians who are going to be available. They're helping the USDA, but they're also going to be available to help those trainers in quarantine. And then we have our AAEP on-call veterinarians, which we have every year. AAEP is gracious enough to send us a couple media trained veterinarians who can help relay any information to the media should an emergency arise on the racetrack. They are the kind of the faces of the AAP to discuss the scientific, but take it to a media level of the information that's going on the racetrack. So with that, that is all we have. We look forward to seeing everybody in Del Mar here in about a month. Again, if anybody has questions, concerns, our contacts, you have that information. This presentation will be hosted by the end of this week on the Breeders' Cup site so that you can get them to the members site and click on this. We're going to post both the narrative version, the video version that we're doing, as well as just the PowerPoint presentation. So you have access to that. You know, we want to help get out as much information as we can. Dr. Blade, do you have any final thoughts?
No, you know, again, as a resource for horsemen, hopefully there's a lot of clarity in there and guidance, but I think there's information in here that you'll go back and look at and may have questions later. And if you do, don't hesitate to contact either Dr. Farmer or myself. And then when you're out here for that week, again, if you have questions, we're more than willing to help, and wish you a successful and enjoyable time at Del Mar, and look forward to seeing everybody.
Awesome. Well, thank you all for joining us. Have a great rest of your day.